इसकी जो मेडिसिन है सिमिसिफ्यूगा, दिस रेमेडी predominantly suits spasmodic dysmenorrhea. Patient complains of pain in lower abdomen, which usually starts on first day of menstruation. Pains persist until the flow ceases. The victims are usually young, unmarried females. Many times the uterus is not developed properly, wearing down sensation with pressing pains in uterine region. Pains are shifting from one hip to another. Menses are suppressed or scanty and are offensive with backache. Nervousness during menstruation. Menstrual blood is blackish and partly clotted. The flow does not ameliorate the pain. The muscular pains are associated with uterine disturbances. It especially acts upon the patient of dysmenorrhea with rheumatic complaints, soreness and stiffness of back and neck, restless feeling in limbs, ovarian neuralgia, shooting and throbbing pain in the head, followed by nausea and vomiting. Mentally, the patient is greatly depressed. Mental symptoms are worse during menses and usually are alternating with rheumatic pains. Patient is always sad and hysterical. Wild feeling in brain, headache after mental exertion and uterine discharge. All the mental as well as physical symptoms aggravated by menstrual flow is the important characteristics of सिमिसिफ्यूगा. उसके बाद इसकी मोडेलिटीज़ हैं. एग्रावेट होता है कंडीशंस इन द मॉर्निंग, कोल्ड एटमॉस्फेयर ड्यूरिंग मेंसेस एंड एज द मेंस्ट्रुअल फ्लो इंक्रीजेस. बेटर फील होता है बाय वार्मथ इन जनरल और रेस्ट. जो नेक्स्ट है वो है कॉलोफेलम. दिस इज अगेन अ सुइटेबल रेमेडी फॉर spasmodic dysmenorrhea. The patient has lack of tonicity of the womb during and before and during menstruation. ये होता है जब हम बहुत सारा पढ़ लेते हैं तब. ओके, बैक टू द टॉपिक. There are spasmodic pains and patient complains that they fly in all directions. Great atony of the muscles of uterus, therefore the discharges stagnate in uterine cavity. Uterus is ill developed or it is smaller than the normal uterus. Cervical os is rigid and cervical meatus is pinhole. Pains are intermittent and come in paroxysm with spasmodic pains of dysmenorrhea. The patient also complains of spasm of stomach with dyspepsia. There is stiffness of small joints of fingers, toes, ankles, etc. Cutting and throbbing pains or flexing the fingers. These pains make the patient to change her position every few minutes. Mentally, the patient is fearful and hysterical. She is restless, easily excitable. मोडेलिटीज़ हैं. एग्रावेट होता है कोल्ड ओपन एयर में और बेटर फील होता है रेस्ट और वार्म से. जो नेक्स्ट इंटरेस्टिंग मेडिसिन है वो है xanthosylum. The action of this remedy is usually on the mucous membrane of uterus and it also acts on ovary. The menses are too early and too painful, usually associated with ovarian neuralgia with pain in loins and lower abdomen. The pains are agonizing and shooting which start in left loin and travel down the thighs. Neuralgic dysmenorrhea is well treated by this remedy. Menses are thick, almost black liquoria at the time of menses. Neurasthenic pains who are thin, emaciated with poor assimilation and insomnia with occipital headache are well treated by this remedy. With dysmenorrhea, there are gripping pains in abdomen with diarrhea. Patient has aphonia and has desire to take long breaths. Weakness or paralysis, especially of left side, followed by spinal disorders. Patient has rheumatic affections, neuralgic shooting pains as if from electric currents. Sleep is disturbed due to pains. Mentally, the patient is nervous, depressed, and frightened, does not wish to express herself. Modalities: aggravate in all the positions, warmth in general, mental exertion, better in open air. Next medicine है Viburnum opulus. This is a useful remedy in spasmodic and membranous Dysmenorrhea, when the menses are too late, scanty, and lasting for few hours. Menses are offensive and are associated with severe cramps in legs, bearing down pains in the uterine region, tearing and shooting pains in ovarian region. On examination, the parts are found congested and edematous, excoriating leukorrhea, which causes itching of genitalia. Patient complains of pain in back, radiating to loins and womb, which are more in the early morning. Uterine complaints associated with cramps in thighs, extending to calf, is the keynote of this remedy. Colicky pain in the pelvic region, lower extremities are stiff and sore with sensation of weakness and heaviness. Patient has frequent urging for urination. Mentally, the patient is irritable with vertigo. She feels as if falling forward. Modalities better by worse aggravated by on lying in a warm room or morning. Better by होता है open air और evening में. Next है Melillotus alba. This is an indicated remedy for congestive and spasmodic dysmenorrhea. Congestion is seen along the genital tract. Congestion of the uterine mucous membrane of the ovaries of the fallopian tubes, which makes the patient restless. This congestion may produce neuritic pains and paresthesia. Menses are scanty and intermittent. Flow starts, stops, and reappears after a gap of 10 to 15 days or so. Striking pains in external genitalia, ovarian neuralgia, throbbing headache with nausea and vomiting, sense of pressure over the orbits, hand and feet are cold. Black spots before the eyes are heavy, blood sight, want to close the eyes tightly to get relief. Pain in knee joints, patient wants to stretch the legs, but this does not relieve the pain. Numbness of lower extremities with pain in knee joint. Mentally, she is forgetful and unable to fix the mind. Wants to run away and hide. Delusions, thinks everyone is looking at her. Patient has fear to talk in loud voice. Modalities aggravate होता है in rainy seasons, change of weather and by motion. Better feel होता है by cold, rest और pressure से. Next है colocynth. Colocynth is an indicated remedy where patient complains of severe neuralgic pains along the course of nerves. The nerve plexus of the ovary or uterus is affected, which gives agonizing pains with great restlessness. Left-sided ovary is usually affected. Burning pains in the ovary. The pains are better by hard pressure and heat. The affected parts become numb with pricking and tingling sensation. Pains are more after eating and after anger. Dysmenorrhea with copious bleeding. The patient is thirsty, appetite is reduced, sometimes there is aversion to food. Colicky pain in abdomen after eating, which sometimes result in nausea and vomiting. Patient retches after vomiting till pain subsides. There is also neuralgic pain in head, violent periodical or intermittent headache. Left-sided sciatica may be the associated symptom. Modalities होती है aggravate होता है evening, after anger, cold, after eating. Better होता है hot fermentation, hard pressure, bending double. Next है belladonna. Congestive dysmenorrhea is well marked in this remedy. Congestion of the endometrium, ovaries, fallopian tubes, cervix, etc. Thus, in short, there is severe inflammation and the parts become very sensitive. Vagina is dry and hot, dragging pains around the loins, severe throbbing in sacrum, profuse menstrual bleeding which is bright red in color. Hemorrhages are hot, uterus is sore and irritated. This is an acute and short-acting remedy. Sudden and violent onset is the keynote of this remedy. Pains come suddenly and disappear suddenly. Inflammatory conditions of the body or particular organ with violent pains and intense heat marked this remedy. The affected parts are red and sore. Throbbing of the affected part is another characteristic of this remedy. Head is red, hot, burning and congested with rush of blood to head. Dryness of mouth. Tongue is dry and bright red. Mental symptoms are usually associated with high fever, hallucinations, delirium, frightfulness, images. The patient becomes wild and violent. She strikes, bites and tears the clothes. Strike करती है, bite करती है, tear करती है clothes को. When the pain subsides, patient goes into semi-comatose state. All the mental symptoms are usually associated with heat, burning and restlessness. Modalities: एग्रावेट होता है टच, मोशन और कोल्ड एयर से. बेटर फील होता है रेस्ट और वार्म रूम से. अदर यूजफुल रेमेडीज फॉर डिस्मेनोरिया आर कैमोमिलिया, एपिस्मेल, लेपिस एल्बम, नेट्रम्यूर, बोरेक्स, अस्ट्रिलेजो एंड लाइकोपोडियम.